Good afternoon, everyone. My name is Bridget Ben Naima. I serve as Director of the University of Ghana Careers and Counseling Directorate. And on behalf of the Registrar of the University of Ghana, in the person of Mrs. Emilia J. Mensah, and the School of Pharmacy of the University of Ghana, and on behalf of my colleagues at the Careers and Counseling Directorate of the University of Ghana, I welcome all of you to this short webinar, but it's going to be very insightful, which is a collaboration between the University of Ghana School of Pharmacy and the Careers and Counseling Directorate. This is one of the major activities lined up as part of the University of Ghana Says No to Drugs campaign, which was launched on the 27th of February this year and is running through this semester. And so we are glad that we have this webinar coming up, and we are very grateful to all of you who have made time to join. Our registrar is on the call, and Madam Registrar, you are most welcome. Thank you so much for making time for this, and thanks to all of you. And so my colleague, counseling psychologist, Miss Edwina Paintil, is going to be serving as our technical manager for this webinar, and she will be assisting us to coordinate the questions time after the presentation. I humbly ask that we all mute our devices to avoid interruptions during the session. But of course, if you need to alert us about anything, please feel free to do so using the hands. You could raise your hands or any of the signs there that you could use to draw our attention. The moderator for this webinar is a professor of social and behavioral pharmacy with strong interest in mental health and well-being. She is currently the Dean of the School of Pharmacy at the University of Ghana, and she is in the person of Professor Irene Krejci. She is going to lead us as the moderator of this webinar, or for this webinar, and she will introduce our speaker to us. And so I humbly hand over to her at this point so that she takes over. Thank you very much, Prof. Over to you. Thank you.
Thank you, Director CCC, and good afternoon to us all. Good afternoon, Madam Registrar, and to our distinguished colleagues as students and all participants. As a School of Pharmacy, we are happy to collaborate with the Careers and Counseling Center to have this webinar on substance use and addiction in the university community. We'll be focusing on the myths, the risk, and the responses. And this discussion forms part of our university's ongoing activities to support the University Says No to Drugs campaign. And this also aligns very well with our strategic objectives, particularly the first one, where we want to provide a transformative student experience for our students and then for the university community as a whole. For today's webinar, we are honored to have a distinguished practitioner who will be sharing her perspectives of substance abuse and use and misuse and addiction along the lines of risk within the university environment and the responses that are required. We are honored to have a lady pharmacist in our midst. She had her Bachelor of Pharmacy degree in 2005 from the Kwame Nkrumah University of Science and Technology, and topped up with a Doctor of Pharmacy degree in 2020 in the same university. She holds an MBA in Health Services Administration and certificates in economic evaluation for health and project management from the University of Washington. She has worked in the past at the Kolebu Teaching Hospital and moved to the Pantine Hospital under the Ministry Mental Health Authorities guide in 2017 and has remained there till date. She is a preceptor for the University of Ghana School of Pharmacy and has been active in our students and taking care of their field trips and then their experiential training within the mental health space. And within the pharmaceutical space as well, she is the vice chair of the Lady Pharmacists Association of Ghana and the treasurer for the Pharmacists in Mental Health in Ghana. Ladies and gentlemen, we are honored to have this seasoned pharmacist and mental health practitioner joining us to share her expertise and experiences with us, and would kindly allow her to take us through the session. Please note down your questions, your comments, and once the presentation is over, we would open up for us to have that deliberation. So once again, welcome and enjoy the presentation. Thank you. So Dr. Edisi, you can share your screen and then begin the session. Edwina, can you please unmute Dr. Edisi?
I tried to unmute her, but it's not working. She will have to unmute from her side.
And she has tried and it's not working.
Okay, let me try. Dr. Adisi, please, is it working now?
Yes, can you hear me?
Yes, please.
Okay, thank you. Good afternoon to everybody.
Good afternoon.
Yes.
We lost your slide, so if you could kindly
I'm going to share it again.
share again, and then kindly put in slide mode, presentation mode.
Okay.
Thank you.
Try to do that. Okay. I hope this is okay.
Yes, please, it is.
Yes, it's okay. But I think you might have to start from the beginning.
So this is the first, okay, this is not the first slide. This is the first slide, yes.
Okay.
So good afternoon, ladies and gentlemen. Thank you so much for this honor to be able to engage you this afternoon. So we are going to have a conversation around substance use and addiction in the university community. We'll look at some of the myths, the risks that they pose, and then some of the responses that the university can put in place to help to mitigate this very concerning public health issue. My name is Dr. Adisi. I'm the chief pharmacist for Pantine Hospital. I'm a preceptor for University of Ghana School of Pharmacy. This is our agenda for today. It's not going to take too much of your time, even though it looks very long. So I saw this quote and I thought it was interesting. The author was anonymous, and he said the first step towards change is awareness. If you want to get out of a bad habit, first you must want to get out of it. And I see this step as a step of the university wanting to get out of this kind of this problem. And it's a very good thing. So we are here to seek knowledge, to share ideas, and to make sure that at the end of the day, we make a headway. Also in Ecclesiastes, it says that that which has been is what will be, that which is done is what will be done, and there is nothing new under the sun. This is just to bring our attention to the fact that substance use and abuse has always been there. It's not something new. However, we see an escalation, and that's where the concern is. So again, this move is a very right move, and it's a step in the right direction. So when we mention university community, it refers to all individuals that are associated with a university. And these include students, employees, former students, alumni, and even visitors who come through. The community encompasses everyone who is formally affiliated with the university and fostering a collaborative environment for learning and growth. So everything we'll discuss here covers all these categories of people. So it covers students, it covers lecturers, families, it covers even those who come and go, visitors, long distance students, everybody associated with the university and who relates with the university in one way or the other. These are a few common myths about substance use that we often hear, or we've collated just a few of them. One of them is that everyone is doing it. The reality is that there are many other students who do not abuse substances, but for some who do, they convince themselves that everyone is doing it. The second myth is that alcohol and drugs help with stress and studying. The reality is that they actually impair memory, focus, and long-term health. The third myth is that addiction is just a lack of willpower, but the reality is that it's a medical condition which involves brain changes. The fourth myth is that I only drink on occasions, but the reality is that binge drinking is worse and it's not good for the body. So when we mention addiction, what are we looking at? We are looking at a chronic or long-term condition that involves compulsive seeking and taking of substance or performing an activity despite negative or harmful consequences. So we know that what we are doing will not be good for us, but it's as if you don't have control over what you are doing, and we persist in doing it. The meaning of addiction can be summarized in these 4 C's. There's a craving for a substance or a habit. There's a compulsion to do it, even though we know that it is not what is good for us. We lose control over whether or not to do it. So there's no alternative. The alternative is we are doing it. And the last thing is that there's continuous use despite knowing the negative consequences. So if we have these 4 in mind, it would help us be able to identify people around us and bring the person's attention that, watch, you are getting into this area, so you must watch what you are doing. A period of time classified as having a substance use disorder. So this is where the medical bit comes in, that it is actually
Dr. DC, I think your slides are off and we also can't hear you. Your slide is off. It's gone off.
to the cravings, the loss of control, and the continuous use. The presence of any 2 is indicative of addiction and it sends a signal of caution. So once you see that you are beginning to get hooked onto a substance, and then maybe you are using it for pain relief or for energy. Some will say, oh, when I get tired, that's when I take this. Maybe they are caffeine tablets, and then you take it when you are tired. Now, at a point, it is not when you are tired, but you feel like you need it before you, so you develop a dependence on it, and from the dependence level, you just get hooked onto it. As the disease of addiction progresses, the ability to organize one's life and predict what is going to happen becomes much more difficult. Because when you get addicted to a substance, or when you get into the area of substance use disorder, it ends up sort of taking over you. So you are not able to, in fact, you don't want to even plan. What you want is for the now. So right now, this is what you are feeling. The craving is there, you must satisfy it. The compulsion is there, you have to go and satisfy that compulsion. You've lost control. All you want to do is to get your hands on it. And then also, you just need to use it continuously to have the feeling that you are enjoying. There are 2 main forms of addiction. The first one is a substance use disorder, which is what we are talking about today. The second one we are for today. These are substances that are usually abused. You have inhalants, you have alcohol, you have marijuana, some prescription medicines, methamphetamine, cocaine, opiates, and hallucinogens. some common examples are tramadol. And with tramadol, it is the strength of the tramadol that gives a level of euphoria. It's usually the tramadol 225 and higher. Usually with the regular tramadol doses of 50 milligram and 100 milligram, you do not get the kind of, you may get some, but not that back. So usually it is the 225 and higher that is abused. And then morphine, these are the opioids. So tramadol, morphine, pethidine, oxycodone, and codeine are termed as opioids. Opioids are analgesics that cross the brain barrier. So they are used for pain relief. And if you do not use them as is directed or indicated, they have this symptom of creating euphoria. So you feel like you feel very lightheaded, you feel sometimes very happy, you are in a good place, you feel like you can achieve anything. So that's and that's the feeling that causes people to always go back. So when the drug is wearing off and the body remembers that very nice feeling, they just go back for it. I must say that for medications like morphine and pethidine, you get a lot of healthcare workers who fall victim to it. Because usually you get pethidine is available on the market only as an injection. So you usually get it in the health facilities. But then all the other, you have something like codeine, the things that was also abused a lot around last year. For about 3 years running, it was a problem. There are cough medications that contain codeine that was actually helping with respiratory symptoms of cough, ended up being abused. So now you get young men who walk into pharmacies and they go and buy drugs like, because we are all professionals, I'll just mention the drugs like Benylin with codeine, and then go and consume everything. Within 3 hours, the person is back to buy Benylin with codeine. So the actual use of the Benylin with codeine was lost. What they wanted was the euphoria feeling they are getting. And then psychotropics, because they are CNS medications that work in the brain, and they work around the receptors that are responsible for the reward system of the body. Most of them are also addictive. However, I must say that if clients use it as they should, they usually don't get hooked onto it. It's clients who use it for wrong indications, and also some who end up using it for the euphoric feeling. So most of the time, because of that feeling, they don't even use it as indicated, but they are used wrongly and they end up getting hooked onto it. We also have other CNS medications like benzodiazepines. I think the Z was lost here. So benzodiazepines, examples are diazepam and lorazepam. And this one, we have a whole range of people who also get hooked onto it. Adults, we have lecturers, we have students who get hooked onto it. Some will say, I can't sleep, and they will go and keep getting diazepam, which we commonly call Valium. They will go and get it, move from 5 milligram, get up to 10 milligram, because after taking 5 milligram for a while, they will not give you the sleep you desire anymore. So they will end up going now for 10 milligram. And then it just goes higher and higher. So once at a point you realize you are dependent on it, and then it goes from even dependence to feeling like there is the need to take it. You feel compelled to take it, even when you are not even sure whether you can sleep.
Dr. Adisi, maybe can you please check your sound again? It's off.
Edwin, I think she's dropped off.
Yeah, she's dropped off.
Okay. Colleagues, apologies. We'll try and resolve that ASAP.
Yes.
Meanwhile, please be noting down your questions, your comments, and then we'll have the opportunity to interact afterwards.
restricted now, but yes. Hello.
Please, you are back. So kindly
I'm
share
so
your
sorry.
screen. Yes,
Yes, I'm
please
so
share
sorry.
your
Let me
screen
just share it
then.
now.
Welcome back.
Thank you for slide share. Okay. Yes, so I was talking about some findings that I thought, please, do you remember the last slide that's where the drop came?
Yes, when you were talking about the medications.
Okay,
Yes,
so like
yeah,
common
this
examples,
slide.
this one. Okay.
Yes,
All right.
this
Thank
slide.
you. Yes. So I just mentioned an example of these are prescription medications. Because I already mentioned the other ones that are used. So prescription medications there are a lot more, but I thought these ones were common currently and then were accessible. So I was talking about a few findings that I came across. A paper by Patrick Terry McElrath et al., which showed that non-college adolescents, in comparison to college adolescents, they realized that the university students had a greater prevalence of alcohol use disorders. Again, a new report from WHO 2024 highlighted about 2.6 million deaths from alcohol consumption for adults and also deaths to psychoactive drug use. The psychoactive drug use are the ones we know as cocaine, heroin, weed, marijuana, and all those other common ones. And the university communities form part of this population. There was also a paper by Deborah et al. In 2021, which highlighted that about 97% of the students on campus know about medication use or substance use and abuse. So the awareness was not a problem. They also stated about 45% were into alcohol abuse and 38% in the use of marijuana. This is statistics that I picked from my hospital. So over a 3-year period, we see that there's been a steady increase. We had inpatients coming in, and our inpatients for our drug rehabilitation center spent at least 6 months, so between 6 months and 1 year. In 2023, we had 36 inpatients for the year. In 2024, we had 39. In 2025, we had 49. And out of that, 26 were between the ages of 16 to 30 years. And then the other people were also above 30 years. So we have clients ranging from around 16 years all the way to even 60 years and above. OPD cases, we also run an OPD lab, OPD rehab, and the OPD saw about 700 cases in 2025. There was a 28% increase from 2024. And out of this number, 212 were with chronic diseases, other chronic illnesses, like either with diabetes, with hypertension, with mental health disease like psychosis, with depression, etc. This is just to let you know that the problem is increasing and has become a public health concern. These are some of the causes of drug misuse. There's socioeconomic status, where people have disposable income, and then they just find a way to use it, and unfortunately, they end up in the wrong place. Mental health conditions like anxiety and depression also causes people, because it ends up making them difficult. They feel like they are not accepted anywhere. And at the end of the day, they end up in areas where these drugs are very accessible, and they feel they are wanted there or accepted there, and they end up staying there. Also for families, when children from families, which includes university children and everything, have conflict exposure and then do not have the guidance they need, There's also environmental pressure. In this case, you can have environmental pressure, peer pressure, and other things from other colleagues. And there's genetic disposition. There are families who are likely, who have the likelihood of addiction. So when, and you find a family that has genetic composition such that they are very easy to get into addiction. And so you find a father being addicted, moving on to the son, moving on to the grandson, and that kind of thing. There's also experimental use. And this has become very important because we are getting younger children coming into the university. Because people will jump their children, SHS1, SHS2, they are writing SSC. When they pass, they come to the university. It's just like JHS1, they write BEC. So we are getting younger. The population is getting younger. And usually with a younger age comes inexperience and also curiosity, high curiosity. So you have experimental use also being a problem. So the pie on the left, the pie on the right actually shows that in the middle ring is actually for secondary schools, and then the outer ring are for college or university students. And realize that for the middle ring, we are getting more peer pressure happening there, and it's understandable. They are in the adolescent age and all that. And in the college ring, we realize stress and depression, and as well as pleasure. Pleasure takes a higher chunk, and then stress and depression also is the higher cause of the students getting into, and even I would say some of the lecturers as well, also getting into drug abuse. So what are some of the risks and the consequences that we see? I just lifted this from the WHO 2024 report I saw, because I thought that it captured what we had to do. It said that substance use severely harms individual health. That is one. It increases the risk of chronic diseases. And this includes chronic diseases include diseases like HIV. It includes diabetes, hypertension, dyslipidemia, and any other chronic disease, even asthma, because of the inhalants and other things, any other chronic disease that you can think about. And it also increases mental health conditions. And because of these mental health conditions, it ends up tragically resulting in millions of preventable deaths every year, and even for the chronic ailments as well, because we hardly check for chronic ailments here in Ghana. People don't just walk into a hospital that I want to check my blood sugar or check my blood pressure. So people walk around with explosive vitals. And then if you have a substance, that's a cause of the chronic ailment, and we are not being diagnosed, this can lead to a lot of premature deaths and preventable deaths within the university community. And this is not just targeted at students. Like I said, everybody who was mentioned as part of the university community is actually at risk of this. It places a heavy burden on families and communities. It increases exposure to accidents, injuries, and violence. And I think this is not new, because we realize some of the violence activities that happen when we have celebrations, when we have like core weeks and other things, and then there's a lot of alcohol. Sometimes we get to hear some of these violence activities that come out, and it's all as a result of the substances, because sometimes at these events we have punches.
Dr. DC, you're off again. Your sound is
Hey.
off.
The sound is off.
Yes, but now
What?
I can hear you.
Okay, so from which point, please?
Risk and consequences. Your
Okay,
slides were okay, but your sound was
all
off.
right. So is the sound better now?
Yes, please.
All right, sorry about that. So to build a healthier, more equitable society, we must urgently commit to bold actions that reduce the negative health and social consequences of alcohol consumption, and make treatment of substance use disorders accessible and affordable. So this is where we can also encourage our students to be using the system. So as we go on, I'll mention what the students' role should be and what the university can also do. But we should encourage our students to be using the systems that we put in place, because if we put in place all the good systems and they do not use it, then it becomes sort of something that becomes useless. So some of the risks, I just wanted to list them out for us to be clear in our minds, that substance use leads to academic stress. Instead of building the myth that it will actually help with academic, it actually leads to academic stress and reduces academic performance as well. It leads to mental health problems, and this mental health problems can affect anybody at all, from children, I mean, all the way to adults. So we have to be very careful. It also leads to violence, and the consequences of these violence can also affect everybody. Perhaps that the reason why we cannot look on for this to continue, because all these implications will not end up affecting, if it's a student or if it's a lecturer who is taking it, will not end up affecting just that person, but everybody else. It also leads to accidents and injuries, and there's also increased population of chronic illnesses. We have another growing concern of increase in NCDs, non-communicable diseases, such as diabetes, such as hypertension, such as mental health conditions like schizophrenia and depression. And these are some of the reasons. And the concern even with that is that the ages are just dropping. It's getting, the ages for these conditions are becoming younger and younger, as compared to what we know regularly, that it was a disease of the aged. Now it's no more, there are no more diseases of the aged because of some of these habits that have become rampant. And we also create negative mentors. Some get into substance abuse because they saw their mentor do it. So you have students who will see a lecturer they admire, who is maybe who uses marijuana or uses any form of drug, and says that that's how it makes my head clear. Before long, because the person admires this person so much, they may also get into it, and the cycle continues because somebody will also look up to this person and also get into substance use. So case in point, case one, we are looking at Whitney Houston, a world-renowned musician who was doing very well. And you can see the clear difference between these two pictures. And finally, he ended up taking her life. So this is what drugs can do, can turn promising people into something that nobody ever thought that they would be like that. So that is the first case in point. Please, I hope you can hear me.
Yes, we can.
Yes, we can hear
Yes,
you.
Yes, please. The second case, Macaulay Culkin, who played the lead role in Home Alone in the 1990 something. And I mean, it was a Christmas movie that everybody would watch. But at 31, Macaulay was involved in drugs. And we can all see the 31-year-old who even looks like a 60-year-old. The last case is a case I picked from my facility, a case on alcohol dependence with psychotic features. For a client, JKM, he's 53-year male, a retired security officer, a single. He came in with chronic alcohol use for more than 30 years, chronic cigarette smoking for more than 30 years. Irritability for 5 years. And then he was now getting visual hallucinations for the past 4 days. So I must state that he had no medical condition. He had never had a psychiatric condition. But after 30 years, he was beginning to develop psychiatric conditions, having positive schizophrenia symptoms of visual hallucinations. So the psychotic symptoms, he was developing visual hallucinations. He was seeing thieves, children, and mice in his room and in his brother's car. He was also having hallucinations associated with acting out behaviors. So trying to hit the people that he was seeing, the thieves and the children he was seeing. So he was hitting people who were not there. And he was also disturbing his neighbors with shouting and talking to unseen persons at night. Recently, he fell 3 days ago after a drinking episode, and then he had pain in his right wrist. So having a mental state examination, we look at the speech. The speech was spontaneous for him, but occasionally he went off. It became irrelevant. The affect, sometimes he felt irritable. The perception, he had reports of hallucination, denies auditory hallucinations, and all that. His insight was poor because he didn't think that he had any problem. He thought that those visions he was seeing were real. The diagnosis was alcohol dependence syndrome. Currently, he's in withdrawal, and there's a pre-contemplative stage. And it's complicated with visual hallucinations, irritability, and risk of injury. So this is a clear case of somebody who had been drinking for so long and is now getting psychotic symptoms. So pretty soon, he will be put on antipsychotics. And then for somebody who could have been doing so well, a man of 53-year-old who could have been doing so well currently. But I must also state that from his history, which is not here because of confidentiality and all, he has 3 siblings who are all alcohol dependent. So they also have alcohol use disorder. 3 of his siblings are all in that habit. What are some of the responses we think the university should live up to? I think there should be awareness campaigns and peer education. So what we are doing is trying to encourage us to have, as part of our celebration, we can also have awareness campaigns where we can talk about drug use, drug misuse, we can talk about substance abuse and all that, because you may be surprised about what that information can do to somebody. There should also be counseling and mental health services, which I know the university does at their counseling unit. So I would encourage that it goes on, because I know that there used to be a psychiatrist who is stationed there from time to time. I don't know if that still goes on, but it's very important that the clinical psychologists are there, and there could be a psychiatrist also who could come there. We think the university should have policies on alcohol and drug use, especially during Hall Week celebrations and other celebrations, because one of the major problems on the university campuses are binge drinking. When there are celebrations like that, some students are not able to control it. They drink so much and sometimes even pass out. So, and then, like I said, they also infuse the alcohols and then the juices with substances like heroin, like cocaine, and other things. Some also have orgies on campus. So there should be a way to fish out some of these things and then put a stop to them. We should have support groups and recovery programs. So when either students or lecturers are bold enough to come to the counseling unit, and then we realize that they need help, there should be a form of support group, because accepting that you need help is a major step. And it's one of the most difficult, because once they accept it, that is when help is made available to them. So it's one of the steps that we need to encourage. And we should have support groups and recovery programs for our community members, so our students, our lecturers, where we need to collaborate with institutions. We can do that. We do get clients here from University of Ghana, clients from other universities who come in here. Some are even sponsored by the university, and I think that's a good thing. So we should have something like that for our community members. I think we should also attach student counselors to different schools or halls as peer counselors. So with psychology students, we can attach them to different halls or different schools. So School of Pharmacy can be, you can have a peer counselor there, attached there. You can have the different schools having peer counselors, because sometimes students like to talk to their fellow students. They think that they understand them better. So I think it would help in that regard. And then we could also add a brief on substance use and abuse during student orientation programs, not like a whole program, but at times, if somebody gets somebody to warn them before they really get integrated into the system, it helps them. And then it also gets them alert to look out for the warning signs, to look out for, even for themselves. We have people who do self-referral into our facilities because they have knowledge about some of these things when they are getting into an addiction area, when they are they are at risk of it, when they see that their colleague is even getting there. There are some who are able to draw your attention, watch it, or even to tell themselves, this is not good. I think it's becoming too rampant. I think I'm becoming dependent on it. I have to watch it. And where they think they cannot overcome it themselves, we have people who come in here as self-referred. They just walk in and say that I need help. I've been trying to overcome this, but I think it's becoming a problem. So I think just a brief to bring the students' mind on the awareness and show them that it is a real thing. It is real. So don't think that, oh, this is a learned community, so it's not there. It is there. So be aware of these things. What the students can do is to talk to a trusted person when they think that things are not going well and they are getting dependent on a substance. They can talk to a trusted person, which can be a counselor at the counseling unit. It can be a peer counselor in their schools. That is, if that is implemented. It can be a parent or anybody, but they must talk to somebody. And if that is not okay for them, they can speak to a professional. For a professional, they don't know anything about you. So some prefer that, somebody who doesn't know about them. So that is where maybe the professionals will come in to also help. The students must avoid places that have these abuse substances, because one of the major issues, and for every paper I have seen, I've realized that alcohol is the most abused substance. And that is because alcohol is so accessible for students, for anybody, for lecturers. Alcohol is so accessible. I mean, for every few meters, you would get somebody who is selling alcohol. So because of that ease of access is the highest in almost every paper I have seen. They can also join support groups that the universities put together. Like we suggested that there should be support groups for people who come and who are willing to join. So if they are willing, they should join this. It encourages for them to know that they are not alone and that there are other people who are also in this. And then these other people are not different from them. So it's okay for them to have that kind of problem, and there's help available. You also have to patronize the counseling services that are available. I have personally patronized UG Counseling Center, and I think that it's an amazing place, and it has very professional people, and they can offer a lot of help. So that's what the students ought to do. We can only encourage them, but the step towards a recovery and a turnaround lies with them. So some final tips and takeaways. Substance use and abuse is both a social and a medical problem. Substance use and abuse is preventable and it is also treatable. The prevention is where the awareness about addictions go out, and then it draws people's attention to when you should stop, when you should say, no, I have to turn back. Otherwise, by the time you decide that this is not good for me, but I have no control, it would have gone too far. And even where it goes far, it can be treated. Can be treated in these. We have a rehabilitation center here at Pantine. There's one at Accra Psychiatric Hospital. I think they're about starting one at Ankafor Hospital. And there are also private rehabilitation centers. It is possible for a turnaround to be made. And then substance use and abuse is progressive. It's a progressive public health issue, and this includes the university community. It is progressing everywhere with a lot of new things coming every day. We came across the Red Encounter last year. There was also the increase, in fact, not just an increase, a jump in shisha use. That's an inhalant. And some of these things, the users think that they are not smoking because they are not holding a cigarette, but it's also still smoke. So with every new day, new things are coming. And these new things, I mean, the awareness is one of the strongest things or activities we can do to bring people's mind to it. Again, substance use and abuse in the university community can affect any player within the community. It can affect a lecturer, it can affect a student, it can affect a visitor, it can affect anybody. Anybody can affect long distance students and anybody who is a player within the community. That is why it is a problem for everybody, so that everybody would help to bring it under control. Universities can play a key role in awareness and support. And I think that has been emphasized quite well. And finally, students can be agents of change in creating healthier communities. When students are able to turn around from addictions, they become agents of change. And even those who do not even start with the use are able to let others know that you can still do well without relying on addictions or without relying on substances that can negatively have an impact on you. So that's what final tips that I will give to you. These are a few references because it's an university community. I cannot just say anything and go away. So I just put a few references together, and I hope I've made some sense to us this afternoon. Thank you very much.
Thank you very much, Dr. Arena Edisi. We are grateful for the insights you have shared with us. And as you can see from the reactions virtually, people are either clapping or giving a thumbs up or loving or liking what you have done. And we are grateful. At this point, we would want to open up for questions, for comments, and for any areas we want to either seek clarity on or even provide some experiences to enrich our discussion. So if you have anything to say, kindly use the raise hand button. Edwina would help us, and then we can invite the people to ask their questions. So we'll take about 3 questions in a row, and then our speaker would respond. Then we'll go for another 3. Alternatively, you could also use the chat option and then type your comments or your queries in there. So, Edwina, you can kindly invite the people whose hands are raised.
Okay. Thank you very much, Professor Akrechi. So as Professor Akrechi said, if you have any question, just use the reaction sign on the hands up or type it in the chat box and I'll read it. So we have Prince. Prince, you can unmute yourself and ask your question.
Hello, good afternoon.
Good afternoon.
Please, it got to a point that I was thinking that when it goes to the medication, there was a part that Doc did not tackle, which is the red. I saw something written there red. When I got there, I think the network went and I didn't hear anything about the rate that was presented.
Okay, thank you. Josie, you can please unmute yourself and ask your question.
Okay, thank you very much. Mine will be the role of the SRC, JCR, and student bodies in this collaborative fight. Do they have a role already, or what plans are there to involve them? Because they can reach out to a larger group of the students that we seek to address. Thank you.
Thank you. Thank you, Josie. I think for now, the questions can be answered and then we go on.
All right. So Dr. DC, kindly respond to the questions. And then I would also invite a rep from Counseling and Career Center to add to the role of the SRC and the JCR as well. So Dr. DC, please go ahead. ADC.
Yes, please. So what I said about RED was that last year, we all heard about the RED canker. It was an abuse drug that was smuggled in from, I think, India. There were a lot of documentaries concerning it, and it was actually a problem in the northern part of Ghana. So that's what I think there was a slang, unim red. When the students and the young people take it, they are sometimes they stay at one place for so many minutes. They can even sleep while standing. It was a combination of some inhalants that were not even licensed here in Ghana. So I'll just bring in our attention to one of the newly abused medications that came in somewhere last year. Yes, please.
And then what role can students groups like the SRC, maybe their leadership, and then other JCR activities play from your perspective?
So I think, yes, please. I mentioned that we can look at things like the SRC celebrations for the whole weeks and other things, and then ensure that the university comes up, or even SRC can actually insist on a substance use policy where you are having these drinks infused with substances like cocaine, heroin, that are available, and some also alcohol. So the SRC has to look at these things and ensure that students are not allowed to use these things during SRC celebrations or whole week celebrations. So that's what I think the SRC can do. And the second thing they can do, there's always SRC week, every whole week. We can slip in an awareness program within the whole week celebrations. Let it not be all celebrations and enjoyments. We don't have to do maybe a sit down awareness. We could even have a morning megaphone awareness where we talk about it. This morning, we are talking about substance use and abuse, something that students will enjoy, but will also get their attention. The important thing is that we need to make the student body aware that this is a real problem and that we all have to come together to solve it. So I think that's what the SRC and then the leaders of the halls can also, that's some of the roles that they can play. Yes.
Thank you very much. And for the SRC and JCR rules, I'm not sure, CCC, are there any particular plans lined up for engaging SRC as part of the UGC No to Drug campaign?
Okay, so Prof. Chair, SRC and GRAS were involved in the launch of the No to Drugs campaign. They actually made a statement and promised that they were also going to take up the challenge to be involved in informing their peers about measures that should be taken to stand against drug abuse and substance abuse and misuse and all that. And so we are working together with them when it comes to awareness creation, when it comes to advertisements for students. They assist us with that as well, using all their channels. What I would want to add to what you've already said is that we have these flyers, giving out messages on the subject almost every week, at least once a week. We have a new one coming up. And so we would encourage them to help us share these pieces of information, even as we share them from the Careers and Counseling Directorate. We are sending links with flyers to the hall administrators, and we will plead with the JCRs to ensure that these messages, these flyers, continue to be shared on their TV screens in the halls, and that will help a great deal. And of course, as you suggested already, as they plan for hall weeks and all those celebrations, they should have something, an activity that helps to create more awareness. Yeah, thank you very much.
Thank you very much, Madam Director. And that's really much on point. And these are very useful areas that the SRC can take advantage of, SRC GRASAC, and then propagate the information widely. And I like the bits, Director, and the note you ended on, that when you share the weekly tidbits, it shouldn't just be on the email webpage, but we should actively also share to our constituents. Thank you so much. Edwin, are any more hands up or any comments in the chat box?
Okay, so currently there's no hands up or comments in the chat box, but it's still open. If you have any question, please, you can just use the raise hand button. It's on top of the screen. If you look on top of your screen, you will see raise with a hand. You can just click on it and then you raise your hand, or you can just type it in the chat box and I'll read it out for you. So the floor is still open.
Or maybe you would want to ask your question privately. You could also do that by walking straight to the Careers and Counseling Center. And there's so much support there for you. If you want to contact Dr. Arena DC also, once you get to the Careers and Counseling Center, we could arrange that to be done.
Yes.
Yeah, so if there are no more hands up or no more chats, I think it's a good time to say a very big thank you to our speaker, Dr. Rene DC from the Pantan Hospital, for sharing the insights and your experiences with us. In fact, in her presentation, one of the striking things was the fact that in 2025 alone, they had to handle about 700 cases of rehabilitation. And that is just Pantan Hospital. We haven't included Accra Psychiatric Hospital. We haven't included the private rehab centers. So the situation is quite dire, and the role we all have to play in ensuring that we resolve the issues of substance abuse and misuse and addiction is critical. We thank you, Dr. ADC, for also taking us through some information about the risk and consequences, and then giving us some case studies for us to, hammer in on the exact examples that you are leading the discussions on. And then you outline some of the responses that we should focus on. And key amongst them is the fact that we all have to collectively work together in ensuring that the lives of the people within the university community are safe and drug safe, and we all jump together to say no to drugs. So as indicated at the beginning of the session, this webinar is part of the University Say No to Drugs campaign, and we are happy that we are committed to this, and please look out for subsequent engagements and subsequent webinars from the Careers and Counseling Center. So on behalf of the School of Pharmacy and the Careers and Counseling Center, we want to thank you for your active participation and engagement. Thank you for joining us, and we wish you a very pleasant day. So I'll hand over back to Director CCC. Thank you.
Thank you very much, Prof. I think all I would add is to say a big thank you to you and to our presenter and to all those who have participated in this webinar. We have learned a lot and we are very grateful. Thank you so, so much. We have to do more of these, and so look out for more. Let me also mention that we tried to do the recording, and so if everything goes well, it will be found on our website, the Careers and Counseling Directorate website, just in case you came in late and so you couldn't hear everything. Look out for the recording on our website. Thank you all so much, and enjoy the rest of the day. Thank you.
Thank you so much.
Just when we're about to log out, a hand came up. I think she's gone back down, so we'll just leave it. Anyways,
Okay, but
Thank
she
you.
can always reach us.
yes, at the
Receive
Careers
clarity.
and Counseling. Yes.
Thank you
Thank
so
you,
much.
everyone.
This is-